Today, we are diving deep into some really powerful investigations looking at Los Angeles County's Child Protective Services. And let me tell you, the sources we analyzed are leveling some incredibly serious allegations. We're going to walk through exactly what they found.
You know, we all kind of grow up with this idea of what Child Protective Services, or CPS, is supposed to be. It's the ultimate safety net, right? The group that swoops in to save the most vulnerable kids from harm. And honestly, that's a really comforting thought.
But the investigations we're digging into here, they pose a really disturbing question. What if that core belief we all have is just wrong? What if the very system we trust to protect children is actually the source of the danger? To even begin to get your head around the scale of this alleged crisis, the sources point to this one staggering number: $4 billion with a B. That's how much LA County is projected to pay by 2025 to settle thousands of child sex abuse claims. A number that big just forces you to ask, what on earth is going on here?
Okay, so first up, let's explore this core contradiction that the investigations really hammer home. The massive gap between what the system promises to do and what the sources claim is actually happening to these kids.
The promise is simple: a safe haven, but the alleged reality, according to statistics cited in these sources, is just brutal. They claim the rate of repeated abuse is actually 18 times higher inside the foster care system than it was in the homes these children were taken from. Just let that sink in for a minute. 18 times.
In this chart, wow, it just lays out the human cost in the starkest terms possible. It shows an escalating tragedy. The number of children dying while they're under CPS supervision in LA County is reportedly going up. It went from 110 in 2022 to 128 just 1 year later.
So the big question is, why? I mean, why would a system designed to protect kids produce these kinds of horrific outcomes? Well, the investigations argue that to get it, you have to follow the money. And that brings us to the alleged financial engine that's driving all of this.
And right at the center of it all is this federal program called Title IV-E. Now, on paper, its job is to help states pay for child welfare. Simple enough. But the sources we're looking at claim its entire structure creates a deeply, deeply messed up incentive.
And here's how they say that incentive model works. Picture a family that's struggling. If they get the support they need to stay together, the state gets almost no federal money. But the second a child is removed from that home and put into foster care, boom, the federal dollars start pouring in. The argument here is that this has created a massive, multi-billion-dollar machine that's built to separate families, not to support them.
This is a direct quote from the source material, and man, it's a gut punch. This is the investigation's absolutely grim conclusion about this whole financial model. They're basically saying that when a system gets paid to break up families, it stops being a safety net and turns into something much, much darker.
So, okay, if there's this powerful financial incentive to remove children, how does the system actually generate the cases to do it? Well, the sources claim it's done by systematically taking the struggles of poverty and just relabeling them as parental neglect.
And this chart really tells the story. According to the sources, a shocking 80% of child welfare cases in LA County are not for the kind of physical or sexual abuse that most of us probably imagine. Nope. The vast majority falls under this big, vague category of neglect. So what does neglect actually look like on the ground? The sources give these exact examples: an empty fridge right before payday, a messy house, a parent who misses a doctor's appointment because they literally can't get off their hourly job. The investigation alleges that these are just symptoms of being poor, but they're being used as the legal justification to tear a family apart.
And what makes all this even worse are the absolutely impossible caseloads. The sources report that some social workers are juggling over 100 different children at once. I mean, in that kind of environment, how could anyone possibly do a thorough investigation? So removal becomes the fastest, easiest option, especially when it's the option that brings in the federal cash.
But according to the investigation, this isn't just about money. The sources allege the system is also being held up by a pretty chilling ideology, one that sees vulnerable families not as people who need help, but as problems that need to be managed, sometimes before a child is even born.
So the investigation really zooms in on this public health program called the Nurse-Family Partnership, or NFP. And on the surface, its mission sounds incredible. Nurses making home visits to support new, low-income moms. I mean, that sounds like a perfect safety net, right? But then,
The sources make this absolutely explosive allegation that the program's real job is to act as a profit-driven abortion pipeline, specifically designed to cut future costs to the state.
Here is the cold, hard financial logic the sources claim is driving this whole thing. A child who might one day end up in foster care could cost the state around 25 grand. An abortion costs about $400. According to this analysis, that's a net financial gain for the state of over $24,000 for every single birth that's avoided in what they call a high-risk population.
And if you want to understand the mindset behind that kind of math, listen to this. This quote, which one text says comes from a sealed deposition from an NFP nurse, was allegedly used as a training mantra. It completely reframes the reproductive choices of poor women. It's not a personal health issue anymore, it's just a line item on a state budget.
So where does an idea like that even come from? Well, citing anecdotal family testimonies, a scholarly analysis looks into the alleged personal views of the NFP's longtime director, and these testimonies claim she supports some really extreme ideas. Things like government-licensed parenting, a belief in restricting the poor from having children, and even forced sterilization for anyone deemed unfit. If these allegations are accurate, it reframes the whole program as a kind of modern-day population control.
So when you put all of these pieces together, the financial incentives, the way poverty is relabeled, this alleged ideology underneath it all, the investigation comes to one single, overarching conclusion.
The final argument from these sources is this. What we're seeing are not isolated failures. This isn't a broken system. They contend that these are all interconnected parts of a machine that is functioning exactly, and I mean exactly, as it was designed to profit from the destruction of vulnerable families.
And all of that leaves us with the final, haunting question that this material poses. When the very system that's designed to protect children is actually incentivized to tear them from their homes, who is left to protect those children from their protectors?